Hello, my name is Matt McKeever, and I will be talking today about my proposed business plan for my desired practice post-graduation, and that will be as an inpatient APRN as part of a transplant surgery team. So this department is part of a much larger hospital. The hospital contains 943 beds, to be exact. This is a 30-bed unit caring for patients that have received kidney transplants, liver transplants, and pancreas transplants. The team includes attending physicians, fellows, surgical residents, social workers, nurses, pharmacists, CNAs, and a team of 5 APRNs that rotate and care for the patients while they're admitted to the hospital. It is located in downtown Chicago. Chicago is a city with a population of about 2.7 million people, according to the U.S. Census Bureau. So the primary population is mostly urban, but it does care for patients from across the state, and the rest of the state of Illinois is primarily rural, so there will be a mix of urban and rural patients. The city of Chicago population is about 33% white, 29.2% African American, and 28.7% Hispanic, with just over 17% of the population falling below the poverty line. There are 4 transplant centers located in Chicago, and this transplant center in particular has a very large Hispanic and African American patient population due to a couple of very successful programs within the department. The first is actually the nation's first Hispanic transplant program, and the other one is a very large African American transplant access program that is led by the first African American female transplant surgeon in the state of Illinois. And both of these programs have worked to address disparities in access to transplant. So the employment contract that I will be negotiating with this hospital does not require a collaborative agreement, and I will discuss that more shortly. The important aspects of the contract that I want to focus on are compensation. The market value for a new graduate nurse practitioner is around $100,000. That is slightly higher in the city of Chicago, closer to $110,000. So that is something that I will be focused on. The work hours will be something that's important to me, and the hours as part of this contract will be 40 hours per week, working 4 10-hour shifts. And the shifts are primarily from 7 a.m. to 5 p.m. There will be no mandatory overtime or call shifts. The physicians handle call shifts overnight, but weekends are required. So every third weekend, I would be required to work Saturday and Sunday. So that will be part of my contract. And holidays are also required, and the hospital recognizes 6 major holidays, and I will be required to work 2 of them. Other benefits that will be an important part of the contract will be vacation time, and that will be 4 weeks of paid vacation time with the ability to roll that over annually. Malpractice insurance will be purchased by the hospital and provided for me as part of my contract, but I will, as the employee, have the option to purchase additional coverage if I so choose. There will also be continuing education benefits, a $2,000 reimbursable fund for continuing education each year to help me pursue the CEUs I need to maintain my licensure, and $6,000 per year towards student loan repayment as long as I work as a full-time employee. Other benefits that will be important are obviously health, dental, life insurance, and a matching 401k. And then an important part of the contract that I will be looking for is annual evaluation and merit-based pay increase. So if I meet all of the metrics and criteria in my annual eval, I will be expecting a increase in correlation with that. So how will me as an APRN be funded as part of this team and provide the hospital with income? There will be a mix of Medicare, Medicaid, and third-party payers. Most will be fee-for-service, and as an APRN, I will be able to bill for hospital admission evaluations, discharges, discharge education, subsequent care each day the patient is in the hospital, as well as additional billing for everything that a patient could require in the hospital, such as tests, imaging, blood work, medical equipment, things like that. So this slide contains a lot of information, but I'll break it down the best I can. This is showing data from the CMS fee-for-service database. It's specific to Chicago, and it's just showing that for every admission evaluation that is done on a patient, the hospital can bill $162. Subsequent care means basically just for a patient that is there who has been there a previous day, evaluating their care, coming up with a plan for that day. They can bill $105, and any discharge plan, any discharge education can be billed for on average $103.50. So a hypothetical day in this department for me as an APRN would involve caring for roughly 10 patients. 2 of them could be admissions, so I could bill $324 for that. 2 could be discharges, and 6 could be patients that were there previously that I am providing subsequent care for. So if you add up those averages, that would come out to roughly $1,161 per day for just over $240,000 per year. And so as APRNs are reimbursed only 85% for what they bill, that number would be close to $205,000 per year that I could bill for as an APRN, and that is solely based on admission evaluation, discharge education, and subsequent care. So as you know, an APRN is responsible for much more than that, ordering tests, ordering blood work, ordering medical equipment. None of those factored into that $205,000 number that I calculated. So a few common tests that I would order for post-surgical patients could be chest x-ray, ultrasounds, or MRIs, and hypothetically, if I were to order one of those tests each per day that I work, that would add another $114,972 that I could bill for. And it's still not accounting for many other types of tests and blood work. And it's also not accounting for the fact that there will be many days I care for more than 10 patients, particularly on weekends when there's less APRN coverage, and I will be covering more patients. So another way that APRNs as part of a surgical team can save the hospital money is shown here. Research recently in Vanderbilt University with implementing APRNs into inpatient surgical teams show that they save the hospital nearly $28 million per year just on one trauma surgical team alone. And this was calculated by the reduced length of stay they saw with patients compared to when they had no APRNs on the team. Improved quality indicators such as CLABSI, CLABSI, pressure injury prevention, and reduced complications, hospital-acquired complications, and reduced unnecessary charges based on audits after the fact. So with this research, it shows that APRNs as part of an inpatient team are saving the hospital millions of dollars every year. So that's something that cannot be shown in the billing, but it's something that shows up at the end of the year with how much money the hospital will be saving. So to discuss the collaborative agreement aspect of the contract, in Illinois, a collaborative practice agreement is required of APRNs in most clinical settings, except those who practice in a hospital setting, so I would fall under that exception. The hospital itself recommends and grants all clinical privileges to the APRNs, so it could differ a little bit from hospital to hospital, and APRNs are able to be granted full authority to order and administer medications, including any controlled substances. One little fun fact about the state of Illinois is that there is full practice authority granted in all settings on one condition, and that is once an APRN has reached 250 hours of continuing education and 4,000 hours of clinical experience as an APRN. So at the hospital, the attending physician will determine the APRN's role in providing care for their patients. So there's no formal agreement, but just as becoming part of the team, you will discuss with the physician and you will have a set role in caring for their patients. And as far as prescriptive authority goes, the hospital just needs to file notice of full prescriptive authority with the government. So now I will talk about how I will be evaluated in my work as an APRN. The patient engagement department of the hospital conducts routine patient satisfaction surveys on an ongoing basis, and some of those questions will revolve around their satisfaction with care provided by advanced practice providers. So I will receive feedback through monthly survey results from the questions that pertain to my care. The APRNs I interviewed earlier in the year preferred peer evaluations to every other form of evaluation and believed that was the best sort of feedback they could receive. So I will be getting evaluated by peers every 6 months, roughly twice a year, by 2 other APRNs that I work with, 2 registered nurses that are part of the team that I work with, and 2 attending physicians that I work with. Other metrics to measure my success are inpatient quality and safety indicators from the Agency for Healthcare Research and Quality. And these are things that are tracked by the hospital and the government and include things such as length of stay, CAUTI-CLABSI, overuse, misuse, all sorts of mortality associated with procedures, things of that nature, as well as patient safety indicators, which provide potential information on hospital complications, adverse events, things like that. And these are metrics that APRNs are closely involved with. So the next few slides contain the APRN practice protocol, and these are all taken directly from Northwestern Memorial Hospital job description for an inpatient APRN. And there's a lot of things that are part of this protocol, but I will highlight just a couple of the important ones. And those include taking health histories and performing H&Ps, admission evaluations, things like that, prescribing and ordering all necessary medications for the patients, ordering and interpreting lab tests or x-rays or other procedures. Other things involve, initiating consults to other departments, providing comprehensive discharge education and ongoing education to patients and their families, and being involved in daily planning and evaluation of patients to determine their need for further health care. And other things would be participating in departmental committees and task forces, participating in quality improvement initiatives specific to the patient population I work with, and maintaining all certifications and continuing education that is required for my license. And here I just have some references listed that I use for my presentation. Thank you very much for your time.